from your experiences running a state agency, supporting parents of young children and helping them getting happy and healthy and ready for school, what are some of the challenges that you see in getting evidence-based parenting supports out there into the world?
I think the challenges, Sherry, exist at all levels, right? At the family level, at the practitioner level, at the policymaker level. And so I want to talk for just a moment about each of those. I think at the family level, many parents know to turn to their medical provider at those well child visits. They're turning to their provider when they have questions or concerns. But those visits are really short and are packed with, immunizations early on, sleepless nights. Oftentimes you're coming into those visits with multiple children. It's not an optimal time to get that really deep supportive coaching. And zooming out to that practitioner level, so often if that medical provider doesn't have the specialized training to support a whole family 2-generation intervention, they're missing those signs of maternal depression. They're not screening for attachment or behavioral concerns early on. And then you think at the policymaker level, so often our policymakers are driven by a desire to do right by young children and their families, but they don't always have that knowledge. So often I'm in rooms, whether it's at the State House or at the United States Capitol, where I come in talking about early childhood and they think I'm going to talk about childcare. Well, childcare is really important, but at the end of the day, young children go home to their families. And so it's also that education, bridge making, if you will, to really help translate research and all the good that we know exists in the world of home visiting and parenting education that we know has efficacy in delivering not only health impacts, but as you mentioned, school readiness impacts, child welfare involvement decreases, even economic stability impacts. We need to be able to translate that to our policymakers so that they can better understand that parenting, home visiting, that these are resources and tools in their toolkit in serving families best.